Okay. So good afternoon. I hope you're hanging with us if you're from the East Coast. I know this is usually my snack time, so I'm really hanging in there myself. My name again is Phyllis Meadows, and my day job is I'm a senior fellow with the Kresge Foundation, but I'm also very, very delighted to be a member of the Population Health Roundtable. So the next session, we're going to divide it up into two parts, all right? We're going to have a before lunch case study, and then we're going to have lunch. Then we're going to have an after lunch case study. So what I want you to do is hold your questions until after you heard from the second case study. But while you're at lunch, I want you to reflect on what you've heard, think about it, digest your food, and pull your questions together. So Dr. Bosch today has been highly quoted because you've said so many wonderful, important things. But one of which really stuck with me was that education can't do this work alone. To achieve success, we need other partners. And clearly from the other examples, folks have to work together. So our first example is a case study of health and education collaboration that comes from Oregon. And we're delighted to be joined by three speakers. The first you'll hear from is Lillian Shirley, who is the director for the Oregon Public Health Division, Oregon Health Authority. Second, you'll hear from Janet Meyer, who is the CEO of Health Share of Oregon. And then finally, we'll hear from Diane Kilkenny, who is the nurse manager for Morrow County, Oregon Public Health Care. Did I get that right? Okay, so we'll turn it over to Lillian. Do you want to sit or stay?
Although you did take my notes.
I did. Before your time.
Thanks, Phyllis. So a couple things just to begin with. We're here to talk about how we're struggling to do all the things that we've learned about this morning. And, you know, as we say, we've known for a long time what to do. It's the how that we need to do it. And here's just some stories from Oregon. We do have political will in Oregon. And we're honored and pleased to be asked to share some of our stories here today. And hopefully we'll get some good input to help us on this journey. Our contribution is basically to just talk about how we're trying to research these, how we're trying to implement the research and tools that we've heard about today. Our statewide tagline for this work is Healthy Kids Learn Better, and we have a state plan that actually looks at all the school and superintendent areas and the coordinated care organizations, which Janet Meyer is going to talk about their participation in this, as well as local public health interventions at the local and state level. So just let me see. Oh, good. So Oregon organized its healthcare transformation around the triple aim: better health, better care, and lower cost. And we've kind of picked that pony and we've stuck with it for the last five and a half years. We're working to achieve our goals, and as we do this to get better health, better care, and lower cost, what we've realized in implementing strategies around achieving this triple aim, it's really driving our payers, and you'll hear from one today, and our providers and policymakers to move to community solutions and community institutions. And schools are a big part of our work. Housing as well. But once you try and get going on that, you realize you can't stay within those confines. Let's see, okay. So this is just a quick schematic. Everybody's got schematics. You know, this is one that we've picked. And I want to take your eyes to the far, I guess it's right-hand side, community prevention and determinants of health. The social determinants of health and education. And today we're talking about how we're integrating that education work. Why are all these areas of concern for our health sector? As we've heard, like earlier, when you look at things like America's health rankings, we consistently are below the mean. And then when we unpack that, you know, and peel that artichoke apart, we realize that we're really above the mean with a lot of the variables. but Oregon has as many as 26% of its students do not graduate on time. And that variable in and of itself pulls us down, even though for some of the other variables for health outcomes, access to care, coverage, et cetera. Immunizations is another area that we struggle with across the state. But so people are beginning to see that narrative together, that all of this comes together. We do track data together, which impacts school attendance, and some of the things that we have worked on is lack of physical activity, inadequate nutrition, substance use, safety concerns, and unintended pregnancy. But the information used by the education districts that we in the public health sector can give them around those very specific outcomes really helps them in their jurisdiction to address and prioritize what supports and interventions they need specifically for the communities that they serve. So this came from California. This schematic. And I'm not going to stay on it very long, but I think just to let you see this, when we talk about the journey that we've been on for 5 years, you can see we started with Medicaid and clinical services. And one of the reasons we say kind of, you know, maybe a little sarcastically, that we could bring all of our payers and providers together around Medicaid transformation and reform, because everybody was losing money on it. And it was a problem for our legislators, it was a problem for our health systems, it was a problem for our payers. So it really brought everybody to the table and say, well, you know, the best we can do is like lose less money, you know. But we're really seeing really good results over time to show that we have actually increased quality, increased care, and also turn down the cost drivers that we see across the state. But where do we want to go? That's just where we started, over there in that green circle. Right now, we are struggling, and you'll hear some stories in that blue circle. Like, how do we bring all of this together? And then where we really want to go is way over there, integrating health, human services, and have community problem solving, specifically to community areas. And some of the if you look down the side there, the payment models, the incentives, these are some of the things that we're experimenting with and driving with to see how we can get to that last circle, the community, the real community driving areas. So let's see. So I'm just going to end with this little slide here to talk a little bit about, these are the areas in our, Dr. Wolf talked about contextual factors. So before we get to keeping kids in school, we got to figure out how do we get them to school. And these are the areas that we've been working on together as a state with common variables and trying to get to common outcomes that we can all say, what does each of this, what do all these sectors contribute to get to healthy Oregonians and kindergarten readiness? We're looking forward. We'll continue to pursue these opportunities. Our approach in the future is even finding more and more less traditional partners. I really appreciated one of the earlier panels saying, you know, how do we sustain this? We've tried to do on the state level memorandums of understanding. So if the Celestial bus comes around the corner for me on the way home, you know, we have, it's not just about the health department director with, you know, whatever, Department of Transportation, Department of Environmental Quality, but we have memorandums of understanding that have been sanctioned by our governor and our legislature between these agencies. So the Oregon approach includes focus on relationships, formalize agreements, target initiatives, and track progress through metrics, incentives that all reflect this cross-sector accountability. So I'm going to stop there so we can get into the real meat of why we're here to hear the stories of these struggles. Thank you for your time and attention, and thank you for inviting Oregon.